holding on the pee too long will cause urinary tract infection. That's some of the major reasons. So don't do that very often. Okay, you're not going to be this year or next year. Number 3 is usually the hospitalized cause called cathedralization. What that means, you know the catheter? Some of the patient has to use a catheter, and which is to help them taking out of the urine sample in the hospital. If the catheter has not been sanitized or not been refreshed for like 1 week, it's keeping in the body, you will see the molds and the yeast are going to grow in there. It will also cause urinary tract infection. So this is usually a hospitalized acquired. So we call it a nosocomial urinary tract infection. And we learned this nosocomial infection. Okay, so that's the reason, there's 3 reasons for that. Now, since this is a microbiology class, so we're going to talk about the bacteria. What is the bacteria? The number 1 causes urinary tract infection. Very simple. The number 1 responsible 80% urinary tract infection is E. coli. And the number 2 followed by that is Klebsiella. Let's say Klebsiella ammonia. And the Enterococcus faecilis. But E. coli is number 1. Okay? Now number 3, how we diagnose. There is several methods to do the diagnosis. Number 1, dip, stick, test. Okay. Number 2, we will do qualitative, then we do quantitative test. Dip stick test, usually I will let everybody do, but this year I will only do a demo. I do myself, then I show you, okay? How to do it? Now, lots of you knows about this. You may test it before in the hospital. Some of you, most of you, some girl will get pregnant, then you go to the hospital, usually they get your urine sample to test that. Is that right? That's quite popular. If you have something feeling not very good, then you go to see a doctor. They ask you to get your urine sample. So you have a cup, and then you go to the restroom, get your urine sample. That's called a casual urine catch. And we have some urine sample right here. It's a measured urine sample. Okay, it's a measured urine sample by our TA. So how we do a test? The first test is called the dipstick test. Dipstick test. I have a dipstick test tube. Inside you will find these type of color sheet. This has to be dipped into the urine sample and take it here to compare a standard color sheet. After you're holding on this about pretty much like 1 minute, you will see any of the color change. Now, this color sheet, there is so many items here, like nitrite, like protein, like urine, like blood keto, glucose, so many items here. What do we really care about for bacteria? So we put this one in, then we take it out. What we really care about? We care about the 3 items. What are those 3 items? Number 1, blood. Number 2, nitrite. Number 3, white blood cell. Okay, if anybody has a presumptive or you're feeling you have a urinary tract infection, you use dipstick test. If it's tested blood positive, that means you may have some problem with kidney, or maybe it's very invasive. because blood cells should not be showing in your urine sample. So the first thing is a blood cell. That's a first marker. The second marker, what are we going to look here, is the nitrite. Now what happened is, we daily take some of the food, like more or less taking some of the meats, taking some of ready-to-eat meat, like ham, hot dog, beef, jerky, whatever ready-to-eat food. Those food, they all have so-called supplement or preservative, which is called nitrate. If it's in your body, you'll more or less have some. If the bacteria in your urine sample, it will be reduced nitrate to become nitrate. And can be tested, use dipstick. So that's the second marker. The third marker, which is on this stick, you can see white blood cell is positive. But we are not really telling you it's a white blood cell. We are actually looking at it. We call it a leukocyte esterase, which means we are looking at the white blood cell enzyme. Okay, so blood cell, white blood cell, and nitrite, those are the three markers. Any of them positive indicate a presumptive UTI. So any of them, any one positive, which means it's presumptive UTI. Okay, so I'm going to show you how to do it. If you're interested, you can do by yourself. Very simple. I have this one. Let's say this is you go to a restroom to get the urine sample. I dip in completely. This is actually not really enough. The volume is not really enough, but actually we dip in, okay? Take it out. Then we compare the color right here. Just like this. So from here you could see this showing a little bit of leukocyte. This showing nitrate is obviously is positive, and we can see the blood cell is actually positive. Okay, so we hold on like that. The blood cell is positive. So we compare. So blood cell is very red. So we compare these color sheet. Okay, that's what we do. I just give you a demo. So that's a dipstick test. You don't have to do. I just show you how to do it. Now what you're going to do is the next two tests. It's pretty simple and pretty straight, but we can talk about it. So let's say one patient has dipstick test. Any of them is positive. So we will say this guy may be presumptive UTI. Then what are we going to do? We have to do is called, number one is qualitative test. How to do qualitative test? Very simple. You have this urine sample. We will do streak plating onto two agars, which is blood agar and the McConkey agar. Now we're going to do the streak plating. You're going to be streak like this. Okay? Then after incubation, we want to see whether there is a colony there. Why we use blood agar? We try to see whether there is a beta hemolytic. If there is a beta hemolytic happens, that may be coming from kidney because it's very invasive. Why we use McConkey agar? Because if E. coli, what we should do, what we will know, it will be pink colony, is that right? Lactose fermentation positive. So we use McConkey agar to see whether it's E. coli, because E. coli is number one causing urinary tract infection. So this is very simple for qualitative qualitative test. Okay, the second test is called the quantitative test. Quantitative test. Which means we're going to have to know the exact number. Now how to do this? This is your urine sample. Okay? You're going to use a loop. This will be a plastic loop. Plastic loop is right here. I'll give to you. Okay? Then you will get a neutron agar. Like this. So get a neutron agar. This is a neutron agar. When this plastic loop, you take it out, you will do a very intensive, gentle streak like this. Then turn 90 degrees. The same loop, don't go back to the urine. Do a second very intensive streak. Okay, then we will do incubation, 35 degrees C, 24 hours. After incubation, we will see the colony there. So after incubation, what you should see is some of the colony there. Okay, then we're going to count the colony. Now, we're going to first of all count the colony. So this is number of the colony. Then we're going to multiply by the dilution factor. Now, what is the dilution factor? This is we are talking about how many is carried on the top of the loop. We assuming 0.001 ml is carrying there. So the dilution factor is 10,000. Oh, sorry, it's 1,000. Okay. Now, why we have to do this? Because medical there is a standard. If you have a urine sample, the bacteria is larger than 100,000 cells per ml. Which means on this place, if you find the colony number is more than 100, this guy is absolutely UTI, clinically diagnosed as UTI. That's why we have to do this quantitative test. If it's between that, what's going to happen? Let's say you get a 30 sample, then maybe your normal, maybe cause cross-contamination. The doctor will say after 3 months, go retest it again. If you get a very clean plate, that should be normal. Because the urine sample ideally should not have any bacteria growing there. Okay, so that's what's going to be to do the work. Very simple. Everybody got to get a loop and put it in, and we do a streak like this, and we do streak like that. Okay, so what we're going to do is you will be get a urine sample from there, but don't block it. This is the really urine sample what we have. Okay, so we get the real human urine, we dilute it 1/2, then we add inoculate E. coli in there, put in the incubation for 2 hours. Then how do we know there's the blood there? We use the bags and put 1 drop of the blood of the whole, then we separate them. So this is really made the urine. Indicate that people have UTI. We don't put any nitrite there because nitrite you put the sodium nitrate powder. We didn't do that. Okay, so everybody will come here to get a 1 urine sample, 1 blood agar. Let's come here. So you will get 1 urine sample and come there here to get 1 loop. 1 blood agar for streak plating, that's to testing whether we have a beta hemolytic. 1 McCarthy agar to testing whether it's E. coli. And this is for quantitative test, to see how many bacteria in the urine sample. Okay, so it's very easy. You have to label it. Okay, very good. Just give them this. I will be open this now. In